We just talked about overfitting, the problem of a model learning its training data too well. But what about the opposite problem? What happens when a model is so simple that it can't even grasp the basic patterns in the data it's learning from? This is the other side of the coin. It's a much simpler problem, but one worth knowing about too, and it's called underfitting. If an overfitted model is like a student who's memorized every past exam paper, an underfitted model is like a student who has only read the first chapter of the textbook. They don't have enough knowledge to answer even the most basic questions correctly. They perform poorly not just on new, unseen questions, but also on the material that they are supposed to have studied. The model is just too simple for the complexity of the task. Imagine trying to predict a patient's risk of cardiovascular events using only their age. While age is an important factor, it's not enough. You're ignoring smoking status, blood pressure, cholesterol, family history, and so on. A model based only on age is destined to be inaccurate because it's too simplistic. It will underfit the data because it lacks the capacity to capture the true, complex relationship between risk factors and outcomes. The model fails to learn the patterns in the first place, resulting in poor performance in all circumstances. So underfitting is less common to see in published papers because it's usually caught and corrected early in the research process. A model that performs badly on the training data itself is unlikely to get published. However, understanding the concept is still useful for two reasons. First, it completes your mental model of how AI training can go wrong. You have the two extremes, overfitting where the model is too complex and learns the noise, and underfitting where the model is too simple and can't even learn the signal. The goal is always to find the sweet spot in between with maximal signal, minimal noise. Second, if you do come across a study where the model's performance is poor across the board on the training data and the test data, then you can now diagnose the problem. It's not that the model memorized the wrong things, it's that the chosen model architecture was fundamentally not sophisticated enough for the clinical problem the researchers were trying to solve. They brought the wrong tool for the job, and perhaps had inadequate training data to detect the trends. So that's underfitting in a nutshell. It's the failure of a model to capture the underlying trend in the data, resulting in poor performance in all circumstances.